Members of the fourth estate, this is our weekly press briefing from the Office of the Government Spokesperson, which is also the National Government Communication Center. And from the outset, we'd really want to thank you, members of the fourth estate, for the support that you have been giving to our office in ensuring that Kenyans get updated and are kept abreast on what their government is doing to ensure that they get value for leadership, value for the money. We, as an office, have noted with concern that there has been deteriorating levels of patriotism in this country. And one of the key issues that we are going to do is to help promote patriotism and nationhood as a key program for our office in order to ensure that Kenyans are able to love their country, be proud of their country, so that they can give the best. So we shall have Uzalendo initiative. Going forward, it's a program so that we can encourage young people and everyone to really love our motherland. Tunasema kwamba sisi kama afisi ya msemaji mkuu wa serikali tunashukuru wanahabari kwa sababu ya vile ambavyo wamekuwa mkitupatia nafasi ya kuelezea Wakenya mambo ambayo ama habari ambazo wanafaa kuzijua kutoka ndani mwa serikali. Na pia tumeweza kujua tukitathmini kwamba hali ama kiwango cha uzalendo kimeweza kushuka sana hivi karibuni kwa hii miaka ambayo tumekuwa tukiishi hivi karibuni, na tunalichukua kama jukumu letu kama ofisi kuhakikisha kwamba tunaweza kusisitizia ama kupatia kipaumbele uzalendo ili Kenya iweze kuwa ni nchi ambayo watu wanajivunia, watu wanaweza kuihodhi na kuienzi, ndiposa tuwe na umoja na utangamano wa kitaifa. Kwa sababu Kenya itasimama, Kenya itainuka, Kenya itanawiri tukiwa na umoja na uzalendo. So now let me go straight to the briefing. The government's commitment to efficiency and excellence remains unwavering as its comprehensive performance and service delivery roadshow continues to get crucial evaluation across ministries, departments, and agencies. The strategic exercise aims to assess the performance of government programs and prospects in all ministries, departments, and agencies. And so far, we've done about 14 ministries. We have about 8 to go. And even as we speak currently, there is an evaluation process that have just come from at Harambee House under the Ministry of Public Service to see what is it that we have done so far. In fact, one of my deputies, Gabriel Muduma, is also representing this office there. The roadshow captures the pulse of government initiatives, tracking progress of our commitments to Kenyans and establishing a way forward on yet to be fulfilled promises. Some of the key achievements in the ministries covered by the roadshow so far include, under the Ministry of Health. Now this is very, very important. We want to update us on what we've done so far, and later on we are going to have another evaluation of the Ministry of Health at Cambridge at 1 o'clock. The Social Health Insurance Fund is a stride towards achieving a more inclusive and accessible healthcare system in Kenya. And we are very happy because the orders were lifted, because what was happening before is the fact that we didn't have any form of insurance in the ensuing period, because the National Health Insurance, people could not afford to pay their medical. And so it was just pending there. Now that will be a thing of the past. NHIF was going to private hospitals and private entities that sometimes were doing more surgeries than the best of hospitals in other jurisdictions, like America. So it was a fraudulent system. But now, most of the money from SHIF will actually go to fund our public hospitals. That is a game changer. So the issue of indigents, those who can't, won't pay, will be a thing of the past because of the following. The SHIF Act establishes the Social Health Authority. So this is a successor to NHIF that is tasked with managing the primary health care fund, that is PHCF. So there are several funds now, not one, for level 1, 2, and 3 hospitals. So the dispensaries, the health centers will be actually getting their monies from this primary health care fund. And then the Social Health Insurance Fund, SHIF, okay, will be dealing with level 4, 5, and 6. So this is our referral mechanism. So the level 1, 2, 3 at the lower level. And then there will be another fund called the Emergency Chronic and Critical Illness Fund, ECCIF, for ailments that require a lot of care due to their effect on the body, whose costs are very high. For example, cancer. We all have a relative or two who really have been ravaged by cancer. And I remember even myself personally, recently, contributing money to a patient who really required, a lot of money, over 2.5 million shillings, and they couldn't manage. And at this point, I also want to address the issue of cancer. Now that I've mentioned it, there has been an outcry at Kenyatta University concerning the lack of Kenyatta University Referral Hospital concerning the lack of cancer drugs. I would want to report to the country that that has now been resolved. It was a procurement issue because of lack of proper projection of stockouts. Now they have put in place, a system to know in advance what is required. Some suppliers have not been paid, but I want to report that now there is medicine at KUTRRH, Kenyatta University Referral Hospital, and also those patients who have not gotten medicine are being contacted and are being asked to go back there to get their cancer treatment. And that will be something that will be managed properly going forward. The Primary Health Care Fund is also funded, or will be funded through the National Assembly allocations, but also through grants and donations. And it will be dedicated to purchasing a spectrum of essential healthcare services. And this includes promotive, preventive, curative, rehabilitative, palliative, and referral services. So promotive, as you may know, is basically about our program with CHPs, the 100,000 army, each in charge of 100 households. You first do preventive, I beg your pardon. Then you promote health services as well, good health practices, I beg your pardon, by them sensitizing communities. These are community health volunteers. So you do promotion that then prevents. Before then you come to cure. As you know, prevention is better than cure. Then you rehabilitate. And then you palliate because of those who may have terminal conditions. And then you refer. So it's a very clear process, well thought out. Before we were just doing preventive and promotive and curative. But now we have added rehabilitation, like for those with disabilities, and also for those who may be on drugs, or whatever other thing that needs to be rehabilitated, but of course also referral, a referral mechanism that is well funded from the 3 types of funds. That is very clear, and that is the innovation of this administration. It is good to say that referral registration for this process is starting on 1st of March. Kwa hivyo Wakenya wajitokeze kwa wingi so that they are able to be registered to benefit from what the government is doing. The Social Health Insurance Fund will pool funds to cover quality health care services for referrals from primary to higher level facilities. Contributions to these funds are designated for indigents. Those are can't pay, won't pay people. That is for the level 1, 2, and 3. Vulnerable persons, and there are many in society. And it could be you. Actually, you are many Kenyans are just one paycheck to poverty. So if you are not employed tomorrow, you may not be able to meet your medical bills. And that, I can tell you, is the reality of many Kenyans. Those under lawful custody, the prisoners, And these monies are going to be appropriated by the National Assembly, but also our development partners, because you know this health is one of the well-funded areas of collaboration because of the Sustainable Development Goals, and health is a right, even within the Universal Declaration of Human Rights, and also the socioeconomic rights as enshrined in Article 43 of our Constitution. Meanwhile, the Emergency, Chronic, and Critical Illness Fund steps in to manage chronic illnesses after social health insurance benefits are depleted. So if you finish your SHIF card limit, then we go to ECCIF. So it's a very clear way. And even for those of us who have maybe the other private medical insurance, after you finish the cover and what it provides for, then you get ex gratia. So this ECCIF is ex gratia for all Kenyans. So it is making everyone to be equal, so that then people do not end up, mortgaging their properties just because they can't afford. And also it will reduce, the idea of many people going out of the country for medication. Because funding will also be here locally sourced, then there will be specialization and you'll get more people because they know eventually when they do so, they will be paid for. The government has also made significant strides in pursuit of a better healthcare environment, as we promised in the bottom-up economic transformation agenda plan. Key of them outlined below. For example, this is very, very important. The number of health facilities have been increased, these are our public hospitals, from 13,841 to the current number of 14,532. 14,532, and this is a 5% increase. With our national bed capacity increasing by 14.8% to the current number to 109,020. This means at any given point, all our beds within our public institutions